Hello, and welcome to the Recovery and Discharge Education, Preparing for Home After Your Heart Surgery. In this video, we will discuss what to expect during your hospital stay, including the discharge checklist, the 3 pillars of discharge when you will go home. This includes lifestyle, incision care, and common medications. And finally, what to expect on the day of discharge, including discharge education and leaving the hospital. Let's begin with your hospital recovery phases and discharge checklist. We will discuss 2 important forms from your folder, the progression to discharge checklist and the 3 home recovery pillars. Let's start with patient progression to discharge checklist. This handout provides you and your loved one with the criteria you must meet before discharge. The patient progression to discharge includes walking 4 times in the hallway daily as you can tolerate, sitting in chair for all meals. If you need additional assistance with walking, you will be working with physical therapy, cardiac rehab, or mobility techs. Some tips and tricks for walking and sitting in the chair for all meals. Take pain medicine 30 minutes to 1 hour before activity. Support or splint your chest with the heart pillow while moving from bed to sitting on the side of the bed with your feet on the floor. To step into a chair or stand to walk. And don't forget to breathe. To meet the checklist criteria, you or your loved one should be walking 4 times a day in the hallway and sitting in the chair for all meals. As you progress to being discharged, there are 2 breathing exercises you will need to be using, an incentive spirometer and a positive expiratory pressure device. After transferring to the Cardiovascular intermediate unit, you and your loved one will most likely be on 2 to 4 liters of oxygen. Every day, the treatment team will work to wean you off oxygen to breathing on room air. To accomplish this, you must use several strategies. First, walking around the hallway, sitting in a chair, and using the incentive spirometer and positive expiratory pressure device will help. You may also need to take medications to remove excess fluid in the body. Some conditions may require you to stay on oxygen longer. If so, you may be prescribed medications to assist in weaning off the oxygen. In some cases, you may go home with oxygen. To meet discharge checklist criteria, you should be breathing on room air or at your home oxygen level before discharge. Pain control is another important criteria to be met before going home. Signs of adequate pain control include being able to sleep, walk, sit in a chair, and perform respiratory exercises. The pain is adequately managed on oral pain medication, and you state your pain is manageable. Pain is expected, but it should be at a manageable level enough for you to complete your daily activities of recovery. Some tips and tricks to control your pain level. Consider using pain medication around the clock for 1 to 3 days after coming to the Cardiovascular intermediate unit. You might need to consider using pain medication 30 minutes before to 1 hour before activity. You can support your chest with the heart pillow when moving or coughing. Always be sure to communicate with your nurse and physician about your pain control. To meet the discharge checklist criteria, your pain should be controlled and you should be able to perform activities. As you progress to discharge, your vital signs will be measured every 4 hours or as needed. To meet your goal, your vitals must be stable or controlled with medication. We will monitor your blood pressure, heart rate, temperature, respirations, and pulse oxygenation, as well as your daily weight. Blood pressure is measured using 2 numbers. The systolic blood pressure, or the top number, is the maximum pressure on the arteries during your heartbeat. An acceptable range is 90 to 140. Diastolic blood pressure, or the bottom number, is the minimum pressure on the arteries when your heart rests between beats. This should range from 50 to 90. Blood pressure problems are often related to pain, activity, or pre-existing conditions. Your heart rate is another vital sign we will measure. A normal heart rate is 50 to 100 beats per minute with a regular, constant beat. Heart rate complications often come from problems with a fast heartbeat or electrical conduction. It is common to have a heart rate issue arise after heart surgery. A normal body temperature is 96.5 to 99.4 degrees Fahrenheit. Low-grade fevers and high white blood cell count are expected after surgery. Your treatment team will encourage activity, breathing exercises, and Tylenol to lower temperature. Normal respirations are 10 to 20 breaths a minute that are even and unlabored. Normal oxygen is more than 92%. People with pre-existing conditions may have a reading of 88% to 92%. Respirations are affected by many things, and your nurse will be constantly monitoring this. Daily weight. Weight gain is expected after surgery due to the amount of fluid received during your surgery and in the ICU. Your treatment team will record your weight daily and monitor your fluid intake and output to monitor your weight progression. Weight gain is usually related to fluid retention after heart surgery. You may be given a medication diuretic to remove excess fluid. After heart surgery, your GI system is sleepy from anesthesia and pain medication. Once your breathing tube is removed, you will start with sucking on ice chips. Next, you will progress to drinking clear liquids. Your diet will be advanced as tolerated. Most patients are on a heart-healthy diet when transferred to the Cardiovascular intermediate unit. To fulfill your discharge checklist, you should have a good appetite with no nausea or vomiting. Bowel movements will be slow to return after surgery. Stool softeners, activity, appetite, and limited narcotics will assist in bowel movements. Urination will also be affected. Patients receive a Foley catheter before surgery. Most Foley catheters are removed in the ICU. After your Foley catheter is removed, you should urinate within 6 to 8 hours. IV pain medication, inactivity, and post-operative surgery can cause trouble urinating. To meet your discharge checklist, you should have a bowel movement and urinate with no issues. Your treatment team will order several lab tests to assess your progress. For example, they will test your electrolytes, coagulation level, and kidney function. Your treatment team will work closely with you to ensure your labs, medication, and vitals are within a therapeutic range before going home. In some cases, you might meet all your checklist criteria except one. For example, elevated fluid weight or abnormal electrolyte levels. To meet your discharge checklist requirements, your provider will have to confirm that all is okay before discharging you to go home. Now we will discuss 3 important pillars for a successful recovery once you go home. We will talk about lifestyle, medication, and incision care. The first pillar of home recovery is lifestyle. You will have certain instructions for your daily activities, including lifting, bathing, driving restrictions, and walking exercises. For 2 weeks, your lifting restrictions include no lifting more than 10 pounds, which is about the weight of a gallon of milk. Your bathing restrictions include no soaking in a tub, bath, or sauna for 2 weeks. Shower at least once a day and clean your incision twice a day. You should not drive or sit in the front of an automobile for 6 weeks. Walk 20 to 30 minutes a day and consider weightlifting 3 times a week. Check your surgical team to find out how much weight you can safely lift. You may go home with a home health aide in about 6 weeks after you leave the hospital. You may have an order from your physician to start cardiac rehabilitation. Another key component of the lifestyle pillar is nutrition. You will be on a low-salt, low-fat, heart-healthy diet. Eat lean proteins that include fish, tofu, and poultry, such as chicken. You should reduce your red meat consumption. Your team will also recommend a carbohydrate or carb-controlled diet. You should always know how many carbs are in your meal. High-carb examples are corn, bread, pasta, and potatoes. It's important to understand the difference between bad carbs and good carbs. Some examples of bad carbs are white bread, white pasta, corn, russet potatoes, and white rice. Good carbs include sweet potatoes, green leafy vegetables, whole wheat, brown rice, quinoa, and berries. The second pillar of home recovery is incision care. We'll briefly review how to clean your incision. You should clean your incision twice a day using dish or antibacterial soap. You should wet the incision, pat on soap, rinse off the soap, and pat dry. It is important not to scrub the incision. Wear loose-fitting shirts and leave incisions clean, dry, and open to air. That means do not place gauze or dressings on the incision. If you have incision drainage, change the dressing daily or as needed. Take note of drainage color, odor, and how much the dressing is getting saturated. Is the drainage increasing? Is the fluid color becoming red? Does the drainage have an odor? If you noticed either of these things, call your doctor. To check for signs of infection, check your temperature, look for redness, swelling, or tenderness. The third pillar of home recovery is medication. First, you should learn how to take your own blood pressure, pulse, and weight before taking your medications. Before your surgery, you should purchase a home blood pressure cuff that measures your heart rate, as well as a scale to monitor your weight. Check your blood pressure and heart rate before taking your medications. Do not take your blood pressure medication if your systolic blood pressure, that is the top number, is less than 100. As well as, don't take your blood pressure medication if your heart rate is less than 55 beats per minute. If you are not sure if you should take your medicine, call your doctor's office. Make it a part of your routine to check your weight every morning at the same time, after urinating, and wearing the same amount of clothes. There are many kinds of blood pressure medications. Each one is unique. Examples of blood pressure medications include metoprolol, hydralazine, and lisinopril. Some of the same medications that help with your blood pressure will also help with your heart rate. For example, amiodarone, metoprolol, labetalol, and cardizem. Anticoagulation medications, or blood thinners, are sometimes prescribed and will depend on the type of surgery and your lifestyle. Some blood thinners will require your team to draw blood to test your therapeutic blood levels before going home. Anticoagulation or blood thinner medication examples are Eliquis, Plavix, Brilinta, and Coumadin, also called warfarin. Cholesterol medications prevents plaque accumulation in arteries and on the inside of your surgical site. Examples include atorvastatin, also called Lipitor, and Crestor. Antiplatelet medication reduces platelets from sticking to surgical areas and prevents platelet accumulation in coronary arteries. This helps to prevent clots. An example of antiplatelet medication is aspirin. Now we will discuss what you can expect on the day of discharge. Your physician team will visit you at bedside to discuss your discharge. You might have a late discharge if you're waiting on a specialist, test results, or imaging. The nursing staff will begin preparing discharge paperwork and inquire about your pickup arrangements. The nurse will educate you about your discharge, covering medication schedules, prescription pickup, activity restrictions, diet restrictions, and follow-up appointments. Once discharge education is done, the nurse will request transportation. Transportation will arrive to your room and transport you to your desired pickup location. Finally, we will discuss safety and falls while you are in the hospital. Always call for assistance when walking. Heart surgery and medications can cause dizzy spells at any time. A fall could be devastating to your health. Always use hand sanitizer when entering and exiting your room or another patient's room. This is very important in protecting yourself and your loved ones and other patients from infections. Visitors should let the nurse know before leaving a patient alone in the room, so that we can assess the room and take any necessary safety steps first. We hope this video has answered any questions you might have had and helped alleviate any of your concerns. If you have questions, don't hesitate to ask your doctor or hospital staff at any time. Thank you for watching, and thank you for choosing Houston Methodist.